Today we're going to be talking about diode laser therapy and the management of soft tissues. So, for some introduction, diode lasers have been found to be an effective instrument in managing soft tissues in the dental field. This innovation is greatly important because as hygienists, we can utilize lasers in some capacities, but they are also great treatment options that we need to be able to explain to patients. Um, there are there's lots of literature to support the effectiveness of diode lasers in soft tissue management. So my thesis statement, oral diode laser therapy enhances soft tissue management in dentistry by providing precise, minimally invasive treatments that reduce pain, bleeding, and recovery time while improving healing outcomes. So our first study looks at 40 patients that had a variety of soft tissue lesions, such as pyogenic granulomas, fibromas, and giant cell granulomas. On all of these patients, minimal swelling was recorded. There were no infections and no sutures were needed. So this supports the fact that diode lasers are effective and a safer alternative, a more positive outcome compared to traditional scalpel surgeries. So for the second study, low laser therapy is an effective treatment of recurrent aphthous ulcers, a clinical case reporting 2 locations, Akrazul and Chikeb 2018. So this was on a singular patient, a female patient, suffering from multiple aphthous ulcers in different locations in her mouth, including the lateral border of her tongue as well as on her buccal mucosa. She was treated with a 915 nanometer diode laser, immediately felt pain relief, and within 5 days, the lesions were seen to be in remission. So this enhanced patient comfort, it induced healing, and can be a great alternative to, just waiting out an aphthous ulcer or, other medications. So our third study, clinical trial to compare conventional incision technique and diode laser on the treatment of oral submucous fibrosis, Shaw et al. 2018. In this study, we were comparing the use of traditional scalpel surgery and laser surgery to treat this chronic condition. So the laser patients, they were split up into even groups of traditional scalpel surgery and then laser patients. The laser patients had less pain post-operatively, better hemostasis during the procedure, and improved mouth opening post-operatively as well. There were less complications, and it had positive chronic condition management for these patients. So, as we've discussed, some non-malignant lesions that diode lasers can be used for treatment. They can also be used for possibly cancerous and malignant lesions. So, in our fourth study, oral leukoplakia management using diode laser, a case report, Chudhary et al. 2019, we were investigating patients that needed biopsies performed and comparing it to scalpel surgery. So the patients that underwent laser therapy had faster healing and less post-operative pain. There was no need for sutures. This can be really practical for these patients that are requiring a biopsy because it's less invasive, less pain, greater hemostasis. Another study discussing the use of diode lasers for malignant lesions, diode laser surgery for early stage oral and oropharyngeal cancer, a comparative study with conventional electrosurgery, Jacobs et al. 2024. So this took several patients, compared them to diode laser therapy, and then some had electrosurgery. The patients that underwent diode laser surgery to remove the cancerous tissues had shorter hospital stays and was just as effective as the electrosurgery in controlling the cancer. The recovery experience was much better for the patients that underwent diode laser therapy, and while still being effective as well. Obviously, as we discussed on the last two slides, diode lasers can be used for taking biopsies and treating malignant lesions. However, the discussion of, what does the laser do histologically to those samples and to the tissue surrounding the areas should also be mentioned. So in our sixth study, diode laser 808 nanometers applied to oral soft tissue lesions, a retrospective study to assess histopathological diagnosis and evaluate physical damage, Angeria et al. 2012. In this study, they used a diode laser to excise soft tissue lesions, and then they were evaluating whether or not thermal damage was done to the cells and the tissues. In this study, they found that samples should be 5 millimeters or greater to have an accurate histopathological evaluation. Anything smaller than 3 millimeters in diameter, significant thermal damage was done. So this is obviously very important to note that there are some limitations with diode laser therapy when taking biopsies and using it for malignant lesions. So our seventh study, ex vivo histological analysis of thermal effects created by a 445 nanometer diode laser in oral soft tissue biopsy, Palea et al. 2020. In this study, the researchers were using cadaver pig tongues to observe if there were any thermal damages done to the tissues and the cells. So obviously, it is ex vivo, so it's not on humans, so that should be noted. But they found that there was minimal histologic impact. So even though we mentioned before, really your biopsy samples should be at least 5 millimeters in diameter or greater, when it comes to actually treating the tissues, there's not much thermal damage being done to the surrounding tissues of, the area that you're treating, the lesion that you're treating, or the biopsy that you're performing. So why is this important, and how do all of these studies kind of come together? Overall, these studies showed positive outcomes for diode lasers. Those positive outcomes include hemostasis, improved healing times, shorter hospital stays compared to more traditional techniques such as scalpel surgery or electrosurgery. There's a need for standardization of wavelengths for protocol. So certain conditions, it's kind of up to the surgeon's judgment what wavelength they want to use or powered laser that they want to use. But I think that the field of dentistry could benefit greatly if there was a more black and white protocol of, we should be using this nanometer on this type of lesion compared to this type of lesion, another lesion. So there's also ongoing research that needs to be done for those histologic impacts and the thermal impacts that can be seen in biopsies. As stated before, that can be seen as a limitation to diode laser therapy use. However, I think the positive outcomes outweigh the negative outcomes of using diode laser therapy in the dental field for soft tissue lesions. So in closing, diode lasers offer safer, faster, less painful soft tissue management, and they can be applicable to benign, chronic, and malignant conditions. This is a promising tool for many clinicians within the dental field, including dental hygienists, oral surgeons, and dentists as well. And here are my references for this presentation. Thank you.